Welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care. If the continuous fire alarm sounds, please evacuate the room, and there's no one in the public gallery, by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in the Guildhall Square. No one would have signed in, so that's fine. There's no members of press or public in. Please could everyone use the microphones and remember to switch them off when they have finished. And then just do introductions, starting to my left.
Anna Martin, Democratic Services.
Simon Nightingale, Assistant Director for Health and Social Care.
Councillor Graham Heaney, Labour Group Spokesman for Community Wellbeing, Health and Care.
Thank you very much. We have no deputation requests today. Apologies for absence. We've had from Councillor Spencer Gardner, the Conservative Group spokesperson, and Andy Biddle, Director of Social Care. So we have Simon sitting in for him today. So very welcome, Simon. Graham, any declarations of interest?
Sorry, no.
Thank you, and I don't have any either. So without further ado, the item number 3, the development of extra care in Portsmouth. Over to you, Simon.
Thank you very much. This paper, with massive thanks to Lynn Church, who's our Senior Commissioner for her work in the report. The purpose is to update the Cabinet Member and spokespeople on the planned extra care development in Portsmouth and to note the current planning status for a scheme at the Edinburgh House site. The background for this, Portsmouth currently operates 4 extra care schemes. Edinburgh House was identified for redevelopment in 2018 following a strategic review. Initial funding of £9.73 million was approved in February 2019, later increased to support an expanded 50-unit scheme. The original building, which was a care home, was demolished by early 2020. In March 2021, the project had progressed to stage 3, with procurement and design underway, design and build underway. Further costing increase brought the total projected budget to £15.65 million, with anticipated support from Homes England and other funding sources. So 2022, the Regeneration Directorate reported a significant rise in estimated costs, now at £18.3 million, due to rising material and labour costs, Brexit-related supply chain issues, post-COVID workforce shortages and global inflation pressures. These factors rendered the project financially unviable at that time. The current position, the project was paused in late 2022 and we reassessed both financial viability and local demand for extra care, which had shifted post-pandemic. Costs are likely to have increased further since this pause. So for next steps, the Cabinet Member is asked to note the planning history and status thus far. A refreshed timeline and development strategy will be brought forward once reassessment is complete and funding options are clarified. So I have a further update on the demand and strategic direction within the report. As mentioned, paused since 2022, and we have now completed a second review of extra care demand in Portsmouth. Our findings show at least a need for 5 new 60 extra care schemes by 2040, with at least 2 of those being required urgently. And this confirms the strategic importance of progressing with the Edinburgh House site and identifying further development opportunities. With regards to the commercial model, the report talks about us in social care having explored alternative delivery models with an engaged Surrey County Council who have successfully implemented the design, build, fund and operate model. Under that model, a private provider funds and operates a scheme under a long lease while the council retains nomination rights. While not cost-free, this approach is significantly more affordable than direct council delivery and includes external, legal and commercial assurance to manage the risk. The Edinburgh House site feasibility we have had a massing study. Apologies, I'm not sure what a massing study is, but it's a study that's confirmed the site has able to accommodate 60 units, aligning the market expectations for viability. Anything less than that unviable from a commercial point of view. This makes Edinburgh House a strong candidate for early delivery under the new model. We have a wider ambition. We have an accommodation with care strategy for 24 to 2034, and within that it identifies the total need for 315 extra care units by 2040. Work is underway across the council to identify additional sites, and providers will be engaged early to understand the pipeline and opportunities. In terms of a project plan, there's a detailed plan in the full report. The project will proceed in 4 key stages, the first being preliminary market engagement and business case, which includes soft market testing and one-to-one provider sessions, development of a full business case and recommendations. Part 2 is the strategy development, where we finalise the procurement approach and prepare tender documentations. Stage 3 is the procurement process itself, likely to be a 2-stage tender with dialogue meetings included, and then award and mobilisation, which is generally contract award, provider onboarding and planning for future schemes. The timeline-wise, we're looking for, if everything's approved and all the stages are agreed, then we would be coming back here with a report somewhere around end of the year, so October, November time, with our latest findings and updates. The earliest procurement process could start would be 2026, January 2026 at the earliest, likely for first contract award towards the end of 2026 for the care provider. Happy to take any questions.
Thank you very much, Simon. Graham, any comments or questions?
Just a couple of questions. I note in paragraph 5.1 that, well, the second part of paragraph 5, when it talks about the Surrey model, then it goes on to talk about the concept, and talking about the site, and it talks about this will not be a nil cost option, as there are costs associated with de-risking the site to make it a proposition attractive to providers. Are you able to say what de-risking the site means? Because obviously it's been demolished, Edinburgh House. Does that mean anything in particular? Have we got contaminants or something we have to sort out? Was that something we would have to sort out first, or not?
So unfortunately I haven't got all the details, but the home before it was a very old building, so I imagine it would be sourcing, checking to see if there's any contaminants and things there. Not expected to be, but you never know.
The second question really relates to 5.3. It talks about council identifying further potential sites. Are we looking mainly at sites that we own that could be reused, repurposed, or are we looking possibly to purchase other sites if they are suitable and come up for sale?
Both. Obviously, if we've got it ourselves, we would prefer that. But if the right model came up, the right site came up in the right place, then we'd have to factor that in. But obviously, it'd be less financially viable to do that. Sometimes somebody comes along with a piece of land, wants to convert it for something similar. Therefore, a deal was to be done in terms of the procurement and delivery. But it really does depend. So yes, we'd look for our own sites first for redevelopment, but we wouldn't exclude external.
Okay, well, I'm happy with the recommendations. I think, the process obviously has been difficult, but I think we've got a way forward, so I'm very happy with it. Thank you.
Thank you, Graham, and thank you, Simon, for that those clarifications. Yeah, I mean, I have no questions, just some comments. As noted on the report, I've requested this, and it's something that I've been had a particular interest in since becoming cabinet member originally back in 2018, and I know this might seem like it's been a slow process, but I think we cannot underestimate, as Simon's mentioned and is in the report, what effects the COVID-19 period did on this, especially when it came to building costs, which since then have not gone down. And obviously we've had things like the additional thing about conflicts around the world, etc. as well. So I think we're in a good place in terms of moving forwards, and I'm happy with the timeline, and I would draw attention to the fact that in the part about the timeline that we have at the bottom of the report, that things have actually already started. So it commenced on the 16th of June, so that was last month. So the vagaries of just how these decision-making meetings come, that we've already made a start on this, as an information-only report, then obviously we can move on that. And I'm looking forward to when we come to a report later in the year, when we have the more firm timelines and process in there, having done the soft market testing, which I know we were pretty sure that we had interested parties, but having been through that beginning process, then we will actually be able to confirm that that is the case. As Simon again said, a really important part of this is that we have nomination rights. Council-owned land, long lease, but we have nomination rights is the most important thing, because that means we can control who goes in there, and it's the right thing for the people of the city. And what I'm really pleased about is the fact that we do have private sector organisations that not only are willing to do this, but we also have evidence from Surrey, and actually using that Surrey model, which is a really positive thing, that we can actually say this isn't something we've just dreamt up as a new thing. This is something that's actually been shown to work in an authority not too far away, and actually making sure that we've got all of that going forward. So I'm very happy to accept the report, pleased with the progress we're making, and I'll look forward to the next report later on in the autumn. So thank you very much. Okay, so on to item 4, the Integrated Learning Disability Service Annual Report. Back to you, Simon.
Thank you very much. So yes, the purpose of this paper is, as you say, to update on the activity of the Integrated Learning Disability Service, the ILDS, if I may, along with sharing some of their challenges and performance activity during the last year, 24 to 25. The headlines in the report centre on caseload and demand. Caseload has rose slightly from 943 to 959 individuals we are working with now. Referrals have now stabilised, but complexity, especially for young people transitioning to adulthood and those eligible for continuing healthcare, continues to grow. We've seen workforce pressures, as most areas have, but with high staff turnover and sickness, it has impacted service delivery throughout the reporting period, particularly for named worker allocation, the model of named worker that we operate within the service. Annual reviews and record keeping, but we are expected to recover to our expected levels of performance this financial year, 25-26. We've seen additional pressures due to other operational pressures within social care. We've had to second staff across to our safeguarding adults team for a period, which did reduce our capacity within the ILDS. The principal psychologist post remains vacant. Recruitment is ongoing. It remains a priority for us. We saw a rise in nursing demand, which meant the service had limited capacity for named worker roles. And our hospital liaison demand increased, and the service wasn't successful with their business case for extra resource due to a number of reasons. And finally, commission services. Most are at or near capacity, especially our day services, respite and accommodation services. Shared lives placements have increased, but 30 referrals remain pending at this time. In terms of performance and activity, our professional contacts has been 26,536 contacts recorded, and that's up 15.6% from last year. The hospital liaison team handled 2,815 of those, mostly face-to-face. From housing, the service has seen 66 accommodation referrals, like last year, but supply remains tight. In terms of budget is for the service is 24.94 million. Currently overspent by 808,000, which is 3.2% of the budget, due to rising demand and complexity of cases. Our provider costs have risen by 8.5%, and our cost avoidance has been achieved of nearly 979,000, and that's through strategic commissioning and working with our providers. The service has seen an older adults moving from family homes added where they were cared for and looked after at home, which has added 1.07 million in pressure through commissioning their placements as a result. In terms of national benchmarking, the ILDS manages 150% more cases, that's 150% more cases and 220% more clinical activity than our national average from the benchmarking we have seen. Despite that, the Portsmouth spend growth is among the lowest nationally. We currently rank 127th lowest out of 140. So it generally means the packages of care we're putting in place is very creative, but very good value for money. In terms of strategic context, our organisational change, we've seen the health element of the integrated team now form part of the Hampshire and Isle of Wight Healthcare NHS Foundation Trust, and the whole service sits within the Portsmouth and South East Hampshire division. However, the team is still based within the civics offices, and our social work capacity that the social care provides is focused on city demand. In terms of regulatory and financial scrutiny, preparation for CQC inspections, as the Care Quality Commission, along with tighter financial oversight from the organisations that commission and provide services to the service, have added to operational pressures. In summary, the Integrated Learning Disability Service continues to deliver a high volume, high complexity service under significant pressure. Recruitment capacity and commissioning remain key challenges, but despite this, the service has maintained performance and achieved cost efficiencies. Strategic planning for the next financial year will focus on workforce stability, service capacity and targeted investment to meet specific areas of growth. And of those, these are expected to be a gradual increase in adults with moderate to severe learning disabilities and a rise in adults with complex needs, including autism and challenging behaviour, especially among younger cohorts. As the first part of the report, there was also an ask to provide clarifications to the report post-briefing, which I believe was on the 30th of June. I have those, which I can either provide or very quickly read out. Councillor Heaney requested several updates and clarifications to the report. The first one was the care values and outcomes, which is page 1 of the info paper. Reference the text being too small, and we have now increased that just so for clarity and for easier reading. The table visibility in page 23 of the full report, we weren't able to action that increase in size, but as the report had already been published, however, we have duly noted it for future edits of the report. The definition of administration was requested for page 20 of the full report. Just to clarify that in the ILDS context, administration refers to clinically relevant non-direct work, such as analysing behavioural data, preparing bespoke therapy materials, creating accessible information, liaising with support networks, etc. It is not general office work, but essential individualised clinical preparation. And finally, the fourth point was around accommodation referrals, which was in page 21 of the full report, section B5, around the numbers. So numbers reflected rolling total. We had 66 new referrals received in the last financial year, the year of the report. 35 people were already waiting from the previous year for a service. 71 referrals were processed to conclusion, closing the case, and 30 people remained on the waiting list at year end. Apologies, the original phrasing was unclear and will be updated in future edits of the report. Happy to take questions.
Thank you, Simon. Graham.
Sorry to be a bit picky, but actually the figures I was referring to are on page 23, not page 21. It's the housing figures. So thank you for the mention of the report. It's the first time I've ever been mentioned in a council report by name. So obviously, you know, fame is looming here, obviously. I did have a question about two aspects. One on page, well, I'll go for big page number 23 and big page number 41. I think I asked a question previously at the briefing about the the number of health action plans that had been agreed, and the target is 85, but we were down to 64. And I think I was questioning whether that was GPs or other people doing that. And I notice on page 40, we talk about primary care doing annual health checks. So there's two elements. There's the health action plan and the annual health checks. I just wanted to quite get the relationship between the two. Obviously, one can form part of another. I understand that. So who is responsible for doing the health action plans to get them up?
Apologies, not an expert, but I believe that part will be the case management team, which sits within the integrated learning disability team itself.
And on the annual health checks, it says 5 practices achieve 75% of LD annual health checks. Do we know what the other practices achieved or didn't achieve by any chance?
Not offhand, unfortunately.
Whether 5 is a good number because it's a lot, or whether 5 is a number because there's only a few. That wasn't quite clear. But we can maybe pick that up later if you want to let me know later. That'd be fine. And because I asked a lot of the questions, I don't really have any other questions. So thank you.
Thank you, Graham. Simon, just one question for you, and I think it might be with your day job hat on, something that might be sort of area of that you know quite a bit about. You mentioned about the turn down of funding for the team at the hospital. Could you maybe go into a bit more information on that?
Don't know the ins and outs of it, but it was one of the funders' decisions in terms of I believe we didn't go through the spend and save from our integrated care board. That's where it went to.
Okay, so it was effectively they had various bids for the money, and that wasn't one that got approved for that, which is I think just a bit disappointing from the point of view, because we know how effective our integrated learning disability services in the city. So yeah, I think that's one of the ones where we're often at the mercy of something we have no control over, and with things like that. So, but I think it's just the case of we just continue to make that case as a city and what we're doing there. I think the other thing I was just going to point out in particular is not in the report itself, but actually the action plan. So, which is obviously on an appendix to the report for anyone who's watching this and looking at the papers. And I think the important thing about the action plan is how extensive it is, and that it does really look at that whole approach. So we have things like housing support and strategy, review of commissioning services, team identity and wellbeing, and commissioned savings, safeguarding, transition, user and carer engagements, and health inequalities. I think that's really a testament to the Integrated Learning Disability Service, that their action plan A is extensive. There are, how many are there? Well, there are tens of actions on there, but also that they cover all of those areas, which I think really, not only for the people who are, for the people with learning disabilities that it's supporting, but also it also looks at the staff wellbeing as well, which, as Simon has mentioned, particularly when we know that in the sector recruitment is an issue, and this isn't just in Portsmouth, it's around, because it is often quite intensive work and difficult, and it's one of those areas in social work where the people who do it are extremely dedicated, but it's also an area where there's quite a large turnover in general. So, but I think that part of that, mitigating that, is actually looking after the staff as well, which I think is really important, and giving them the real support, and obviously working very closely, as it's an integrated team, across with the nurses in the NHS. So I think it's worth pointing out that action plan, which is very all-encompassing, and also about that demand on service, that the demand is going up, and we know that will continue to go up as people with learning disabilities who in the past, in frank terms, may not have survived childhood, now are surviving childhood with movements in medical technology and support. But that does mean that we then have to support them, as we absolutely should, and we're proud to, in adulthood. But that does do that. And obviously, there's also the improvement in diagnosis of learning disabilities as well. And we know, I think I might have related this before, a few years ago when I was a support worker, I supported someone who was in their early 50s and was first diagnosed with a learning disability in their early 50s. And that was because the mechanisms weren't in place when he was younger to do that. And that meant that he was without support for over 30 years that he should have had otherwise, if he'd had the diagnosis and been supported from when he became an adult. So early diagnosis is really key as a child, or indeed in early adulthood if it has been captured. So I think that's something, again, that we've done a huge amount of work on. But we're also, as Simon again pointed out and is in the report, we are managing to do it in a cost-effective way. For our rise on spending to be so low, where our demand on our services is no different or maybe slightly more than other authorities per head of population, I think goes to show the success of an integrated service. And that really is the work that we're doing with the NHS. So my thanks to Ian and everyone on the team for all the work they're doing. Their honesty with the report as well, that there's always improvements that can be made, but I think we do have a fantastic integrated learning disability team. We know it's the only one like it in the whole country, that it's fully integrated, and we know that it provides a fantastic service. When it was last inspected, it was expected as outstanding, and I think that's something we should always make sure we support as much as possible. And quite frankly, with the uncertainties of the future, both coming from the Integrated Care Board and also from local government organisation, I think the more we can make sure that we support this now, and whatever happens in the future, a pathway goes through to make sure that it stays integrated and stays working for the people of the city, is massively important. So thank you for the report. Please pass on my thanks, I'm sure Graham's as well, and the whole of the council to the team, and it's really good to see what the action plan and the priorities are for the future as well. So thank you very much, and that's it.
Can I just add a final comment?
Oh, go on,
what's interesting is the benchmarking data on pages 28 and 29 actually do highlight, although they don't show everything, how good the service is. You know, we've got highest caseloads, we've got more spent on the clinical stars. Yeah, there's also really good stuff, and the conclusion actually also highlights that, you know, there's really good stuff there, and some of it's not picked up by the sort of national data as well, which I think is a testimony to the sort of work you do. So yeah, I'm very pleased with what they've done. So congratulations.
Thank you, Graham. Yeah, I think that's the thing. It's not just we're saying it's good because we're saying it's good. It shows it in the report, and it is, you know, and as I say, services don't get marked as outstanding if they're not outstanding. That's not the way CQC works, and that's not the way the inspection regimes works. And so we are, I say, incredibly fortunate. I went as a I go to the Learning Disability Partnership Boards regularly. I was fortunate with my work hat on to be at the Moving Forward event that takes place every year at Fratton Park, which is our road show for people with learning disabilities and their families. And it's incredibly well attended. There's so much interaction there. And as I say, I think I know we do so much in this city about this, and we really value our people with learning disability. Indeed, just before I was, I'll just conclude on this, just before I'd been here, and as Graham will know, I had Cora, who's sort of a member of the Youth Parliament, Portsmouth Youth Parliament, Youth Cabinet rather, and I was showing around the Civic, you know, showing her where bits and pieces are. And one of the places I went to was the View, and showed her said, and this is run by Minstead Trust, Lily and Lime at Minstead Trust, and that's for our people with learning disabilities. And that all goes back to when the cafe was closed after COVID, when we were looking at reopening it. Suddenly it came, well, why don't we do this with Minstead Trust, with Lily and Lime? Why don't we do this as an opportunity for people with learning disabilities in our civic offices to have an opportunity to work in our civic offices? And they have, and that's been a massive success. And the team, I go up there every Tuesday when I'm in for cabinets, and I'm on lunch, and it's really fantastic because the team that are there, a lot of them have been there since the beginning. So they've carried on there. It's given them an opportunity to work there. And the reason why we can do things like that is because of the work that the Integrated Learning Disability Service and the Learning Disability Partnership Board has done with those providers over many, many years, built those relationships and really made those opportunities. And I'm really pleased that we made the case at Adult Social Care and with the Integrated Learning Disability Service to do that procurement when it came up and do it as an opportunity for people with learning disabilities in the city. So, yeah, that's just, I think, something practical that we can really see every day and the real opportunities it gives. That does conclude the meeting, so happy to note that report and, as I say, express our thanks to everyone in the team and the amazing job they do. Thank you very much, everyone.